Hello, my name is Dr. Kemi. I am board certified by the American Academy of Dermatology, and I also completed fellowship training in Mohs surgery. I grew up here in Maryland, and I'm excited to return to the Old Line State after completing my medical training. I've been working in the field of dermatology since 2018. I'm honored to develop a personalized approach to treating your skin cancer. The American Academy of Dermatology recommends surgical removal of all skin cancers. The most effective removal process is through Mohs surgery, which offers the highest cure rate and spares the most tissue. We use a local anesthetic administered directly into the skin to ensure your comfort during the procedure. We remove tissue, test it while you wait, and examine it under the microscope to ensure that all cancerous cells are gone before stitching the area closed. Sutures remain on the skin between 7 to 14 days and are removed by our clinical staff at your follow-up visit. But for majority of our patients, we use absorbable sutures, which can be more convenient for patients as no follow-up visit is required. On the day of your surgery, feel free to eat, drink, and continue your regular medications, including blood thinners, unless the prescriber of the medication tells you otherwise. Because we use local anesthetic, you are free to drive to and from your appointment. Our team will review wound care instructions with you on the day of your procedure. Some items to have on hand include gauze, medical tape, Vaseline, and Tylenol for pain. You can also refer to our post-op video from our MA team. The link has been emailed to you and can also be found on YouTube. At Dermatology Partners, we are committed to making your experience as comfortable as possible. We look forward to seeing you and thank you for entrusting us with your dermatological care.